Hi, I'm Zakir Seth, management consultant and business coach, specializing in implementation of various management parameters, especially the one that I like, the 80-20 principle, which I've found to be very effective and powerful in various organizations. Today, I'm sharing my thoughts on a topic that has been concerning me and I'm sure has been of concern to all of you. The very fast spread of the coronavirus, which seems like it's going out of control. With the vaccine not being seen and the progress not very encouraging, and it looks like we are at least months away from a vaccine that can help us get away from this coronavirus pandemic. It's very important to study and understand and analyze why the spread is happening at such a fast pace. I'm not from the medical field and have nothing to do with the medical or health fraternity. So the analysis that I'm doing or the thoughts that I'm sharing is purely based on management principles, especially the principle of 80-20, which I firmly believe is embedded in everything that happens. Every result that comes has its base in a 20 to 30% activity, which is ballooning into a major impact result. I believe strongly that the coronavirus, which has no wings of its own, is being given momentum or turbo thrust by our casual attitude in our comfort zone. Let me clarify what I mean by the comfort zone. Let me split our time into two parts, the public zone time and the comfort zone time. Now, while we are in the public, where the law requires us to wear the mask and have social distancing, we are alert because we are outside and we are maybe feeling that we are dealing with strangers. That's the public zone. Now let's look at the comfort zone. When I say the comfort zone, what I mean is while we are in our own houses or the houses of our friends and relatives and colleagues, we tend to drop our guard. When we meet our friends or relatives, or we're visiting our parents or close colleagues, we tend to drop the guard and we are not wearing the mask most of the time. Or we sit closely and we are not following social distancing norms. So I firmly believe that it is this comfort zone that is giving wings to the coronavirus, enabling it to multiply. The proof is the COVID clusters. Now, when you look at COVID clusters, you find that initially one person gets infected. Maybe it's the person who keeps going out from the house and maybe the others are not going out much. Then he or she spreads it within the family, within the close neighborhood. Let me give you an example here. I refer to a study from the Center for Disease Control and Prevention from the United States, which states about a hairdressing salon in Springfield, Missouri. In this salon, there were two hairstylists, stylist A and stylist B. From day 0 up to day 8, the two stylists, stylist A and stylist B, attended to 139 customers, 139 clients. And upon the two stylists testing positive, the city authorities tested or they checked out all the 139 clients and later on found that none of them had been positive and they were all negative and were not showing any symptoms, just because the salon was following the city rules of the stylist as well as the clients not taking the mask off and having the mask on at all times, although the stylists would have been in close proximity to the clients. Now, on the other hand, one could ask then how stylist B got infected from stylist A. So it was found that in the time when there were no clients, in the time between clients, while they were interacting or speaking to each other, the stylists would take the mask off, and that led to the infection. Now, going a step forward, stylist A had 4 people testing positive in her close proximity, showing again that when the mask is off, when there is casualness, the spread will tend to increase and fast. So here you have one person testing positive, And then as a result of the casualness of this person, she is infected 4 or 5 more people. So it's, in my opinion, it's very important, and I firmly believe that the thrust, the momentum that the coronavirus is having in having such a fast spread, in multiplying from hundreds to thousands and God knows where, is coming from our casualness in the comfort zone. When we are in our homes, when we are in the comfort of our homes or relatives' houses or friends, or even in the back offices, in our workplace, when we are not in public facing positions, when we are in the back office, in the lunch room, in the coffee space, we tend to take our masks off and we are being very casual, which is giving a lot of momentum to the coronavirus. If we change our attitude here, this is one tip, this is the one attitude that we need to change now, that we have to ensure that we will not be the ones to give wings to the coronavirus. We will make sure that it slows down. Now, when we analyze the comfort zone, when we are in the confines of a closed space or less ventilated space, it is fulfilling all the parameters which the medical fraternity states is a danger zone for corona transmission. Closed space, prolonged interaction between people, less ventilation, talking in maybe a little loud voice because there may be people across the hall. So these are activities which we have to take care. Now the transmission in the public area, the government is doing a good job. In many countries, there is a steep fine if people don't wear masks while they're outside. If the shops or commercial establishments don't adhere to social distancing norms, then they are fined. But the control inside our own homes has to be we ourselves. Just yesterday, I was reading a message from a close friend of ours. She was saying with great relief that her aged parents, maybe the father was 90 and the mother was 85, have thankfully recovered from the coronavirus. And then she casually mentioned that they caught it from her daughter. So it is we who are unintentionally infecting our near and loved ones because we are not taking care in our comfort zone the same amount of care that we are taking outside. So it's time to change, it's time to be alert, it's time to implement the full COVID protocol even while we are at home and get this thing out of our way. We are in for critical times as the world is getting into the festive season in the next couple of months. In India, there is Diwali coming. In the US, there is Thanksgiving and there is Christmas all around the world and New Year get-togethers. So it's very important that as we interact with within our close social circle, the COVID parameters must not be compromised. Especially now, the vaccine looks a few months at least away. If you're with me on the thoughts that I've shared and you agree with what I have said, then take out a sheet of paper, draw a line, segregating the page into 2 parts. Write on the one side public zone time, and on the other side you can write comfort zone time. And on the comfort zone time, write down, try to list out the number of times when you feel in hindsight or reviewing the last 7 days where you feel that the casualness in not wearing the mask or not keeping distance or not following COVID protocol at home, maybe after coming home from being outside, where you feel you could have compromised the safety and security of the loved ones in the house. This could maybe open our eyes on where we are going wrong and how we can tighten up and ensure that whatever, even if we are infected outside the house, it's going to stop at one. That we are not going to be the one to bring it home and spread it to our dear and loved ones and magnify the number of corona spread that we are continuing to see every day.